Imagine you are diagnosed with a terminal ailment that has no cure. You're going to suffer constant pain, and you will die within 6 months. Would you choose to live out your life suffering, or would you rather have the option to pass away on your own? This is sometimes called euthanasia. Today, I would like to inform you about euthanasia, as well as assisted suicide, its different forms, the current laws regarding it, and how states are able to regulate assisted suicide when performed by a physician. Let us start with describing exactly what euthanasia is. Euthanasia is known as mercy killing. It's taken from the Greek word for a good death. This is in the sense that a person who is long suffering and will not be cured and is guaranteed death deserves the right to end their own life. There are two forms of euthanasia: passive and active. Passive euthanasia is the act of removing a feeding tube or any other artificial life support device that is keeping a person alive longer than they would be capable on their own. Remove the device, the person passes away. In active euthanasia, there is an administration of drugs, and the dosage of that drug is gradually increased, usually to cure the pain of the patient, but eventually leading to a lethal dose that brings about death. The majority of these cases are voluntary. They are people who are knowing what they're doing, they understand what they are going to be missing, what they are giving up, but they are making that choice on their own. Contrarily, there are people that have been involuntarily euthanized, people that may not have had a say in what they wanted, but someone believed they were suffering enough that they ended their life for them. Whether right or wrong, it does occur. Now, hopefully we're fully aware of what euthanasia and assisted suicide are and their differences. Let's take a bit of a look at the laws regarding the practice of these things. While there is no specific federal law in regards to euthanasia, all 50 states and the District of Columbia regard it under general homicide laws. Therefore, it is treated very seriously. Assisted suicide laws, however, are handled at the state level rather than the federal, and it can vary from state to state. 36 states have specific mandates prohibiting all forms of assisted suicide. 7 states prohibit against assisted suicide based solely on common law. 4 states, Hawaii, Nevada, Utah, and Wyoming, as well as the district, have never formally discussed the subject or created any. 4 states have no laws regarding euthanasia or assisted suicide and do not recognize common law on the subject. There are 3 states, however, who have legalized physician-assisted suicide, and they are Montana, Oregon, and Washington. And now that we know where these states stand, we're going to take a look at how Washington, who has legalized physician-assisted suicide, is able to regulate the doctors that perform it. Under the Washington Death Dignity Act, which was passed in November of 2008, doctors are permitted to prescribe lethal amounts of medication to terminally ill patients who have 6 months to live or less. It is only possible to perform this if the patient has made 2 separate requests to the doctor, one oral and one written, 2 weeks apart, that say that they wish for the doctor to assist them in their death. This gives them time to consider what they are requesting. And if they still feel the same way, the doctor will provide them a lethal dose the doctor will provide a lethal dose so the patient is capable of ending their own life. The doctor himself is incapable of actually administering the dosage because the liability factor is there. I hope you now have a better understanding of the difference between euthanasia and assisted suicide, how they are viewed by the states, and how assisted suicide by physicians is regulated by the states that have allowed it. These will continue to be hotly contested issues from both sides of the fence. Whether you believe a terminally ill person has the right to choose when they die, or whether you believe that it is never a person's choice when they die, we all must agree that we need to gather a better understanding of what these people are truly going through before we make decisions on their behalf. Thank you.